To stay updated with future videos like this, don't forget to like this video and subscribe to the channel. Welcome back. Our future nurses, let's dive right in. 1. The field of nursing with a focus on the utmost care of unstable patients facing life-threatening problems is referred to as A. Medical surgical nursing. B. Community nursing. C. Critical care nursing. D. Emergency and disaster nursing. Answer: C. Critical care nursing. Rationale: critical care nursing focuses on patients with life-threatening conditions who require continuous monitoring and advanced interventions. Strategy: medical surgical equals general hospital care, community equals public health, emergency/disaster equals pre-hospital and mass casualty. 2. The AACN has developed standards of practice for the care of critically ill persons. One of the following is not a legal duty of the critical care nurse. A. Observe. B. Anticipate. C. Assess. D. Report. Answer: B. Anticipate. Rationale: legal duties include observing, assessing, and reporting patient status. Anticipation is a clinical skill, but not a legal duty. Strategy: look for the option that doesn't directly tie to legal responsibility. 3. Admission quick check assessment in the critical care unit involves assessing the patient in various areas. Which one of the following is not included? A. Anxiety. B. Airway. C. General appearance. D. Breathing. Answer: A. Anxiety. Rationale: the quick check in CCU equals airway, breathing, circulation, disability, exposure, ABCDE. Anxiety is psychosocial, not part of immediate quick check. Strategy: think ABCs first, psychosocial factors come later. 4. The D in the ABCDE model of assessment and planning of care in the CCU stands for A. Disorientation. B. Deficiencies. C. Dissociation. D. Disability. Answer: D. Disability. Rationale: ABCD equals airway, breathing, circulation, disability, neurostatus, exposure/environmental control. Strategy: memorize the ABCD model for rapid assessment. 5. The physical aspect of the critical care environment contributes to recovery. The nurse manages the environment by all except A. Adequate lighting. B. Regulation of temperature. C. Freedom of visitation. D. Elimination of excess noise. Answer: C. Freedom of visitation. Rationale: critical care visitation is usually controlled to reduce infection risk and promote rest. Lighting, temperature, and noise control are essential environmental measures. Strategy: when you see except, focus on what does not support recovery. 6. Critical care units have classifications and features. Which is a feature of Level 2 CCU? A. Short-term ventilation. B. Long-term ventilation. C. Nurse-patient ratio 1:3. D. Nurse-patient ratio 1:1. Answer: A. Short-term ventilation. Rationale: Level 1, basic monitoring. Level 2, more advanced care, short-term ventilation. Level 3, advanced life support, long-term ventilation, 1:1 care. Strategy: match the level with acuity, higher level equals more resources. 7. Level 1 critical care unit is known for A. Resident doctors at all times. B. Nurse-patient ratio 1:3. C. Long-term ventilation. D. Invasive hemodynamic monitoring. Answer: B. Nurse-patient ratio 1:3. Rationale: Level 1 provides basic critical care, usually with less intensive monitoring and higher nurse-patient ratios, 1:3 or more. Strategy: higher nurse-patient ratios equals lower-level CCU. 8. Which of the following features does not apply to Level 3 critical care patients? A. At risk for deterioration. B. Multi-organ failure. C. Basic respiratory support. D. Advanced respiratory support. Answer: C. Basic respiratory support. Rationale: Level 3 patients need advanced interventions, ventilation, invasive monitoring, multi-organ support. Basic support applies to level 1. Strategy, think of level 3 equals sickest patients with the most advanced care. 9. A life-saving technique that is useful in many emergencies when someone's breathing or heartbeat has stopped is referred to as A. Basic life support. B. Emergency nursing care. C. Cardiopulmonary resuscitation. D. Critical care nursing. Answer, C. Cardiopulmonary resuscitation, CPR. Rationale, CPR is the immediate life-saving procedure to maintain circulation and breathing until advanced measures are available. Strategy, remember, BLS is the process, but the actual technique when heart/lungs stop is CPR. 10. A client who sustained an inhalation injury arrives at the emergency unit. On initial assessment, the nurse notes that the client is very confused and aggressive. As a critical care student nurse, which of the following would you note the client is likely experiencing? A. Anxiety. B. Fear. C. Pain. D. Hypoxia. Answer, D. Hypoxia. Rationale, confusion, restlessness, and aggression are early signs of hypoxia due to inadequate oxygen delivery to the brain. Strategy, always think airway plus oxygen first in inhalation injuries. 11. Clients in the ________ are at the most vulnerable stage. A. ICU. B. Children's ward. C. Medical ward. D. Surgical ward. Answer, A. ICU. Rationale, clients in the ICU are critically ill, unstable, and most vulnerable to life-threatening complications. Strategy, when you see most vulnerable, always think of critically ill, ICU. 12. Check breathing, look, listen, and feel 4_____ seconds before commencing resuscitation. A. 5 to 8 seconds. B. 5 to 9 seconds. C. 5 to 10 seconds. D. 5 to 11 seconds. Answer, C. 5 to 10 seconds. Rationale, current CPR guidelines recommend assessing breathing for no more than 10 seconds before starting resuscitation. Strategy, don't waste time, less than or equal to 10 seconds only. 13. During resuscitation of an infant or a child, the depth of chest compressions is A. 4 to February 5th. B. 1/3 to 1/2 of chest depth. C. 1/5 to 1/5. D. 1/3 to 2/3. Answer, B. 1/3 to 1/2 of chest depth. Rationale, compression depth for infants and children equals about 1/3 of the anterior-posterior chest diameter, almost equals 4 cm in infants, 5 cm in children. Strategy, always remember the 1/3 chest depth rule for pediatrics. 14. Heart rate of ______ per minute is normal. A. 60 to 70. B. 60 to 80. C. 60 to 90. D. 60 to 100. Answer, D. 60 to 100. Rationale, the normal adult heart rate is 60 to 100 beats/minute. Strategy, NCLEX likes the full normal range 60 to 100 BPM. 15. When attending to a client with a head and neck trauma following a vehicular accident, the nurse's initial action is to A. Do oral and nasal suctioning. B. Immobilize the cervical area. C. Provide oxygen therapy. D. Initiate intravenous access. Answer, B. Immobilize the cervical area. Rationale. In trauma, the first priority is to stabilize the cervical spine to prevent spinal cord injury. Airway and 4 come after immobilization. Strategy, think C-spine first in trauma care. 16. Which of the following is not a contraindication for cardiopulmonary resuscitation, CPR? A. Terminal illness situation. B. Survival would be meaningless. C. Cardiac arrest. D. Do not resuscitate, DNR, order. Answer, C. Cardiac arrest. Rationale, CPR is indicated in cardiac arrest. The others, terminal illness, futility, DNR order, are legitimate reasons to withhold CPR. Strategy, the question says not flip your thinking. Cardiac arrest equals when CPR is done, not avoided. 17. All of the following are signs of bleeding except A. Rapid and weak pulse. B. Decreased level of consciousness. C. Decreased urine output. D. Pain. Answer, D. Pain. Rationale: bleeding produces hypoperfusion signs, tachycardia with weak pulse, decreased urine output, decreased LOC. Pain is not a classic systemic indicator. Strategy: look for objective perfusion-related changes when assessing bleeding. 18. A client sustained an inhalation burn injury. Which nursing intervention should be in the plan of care? A. Monitor oxygen saturation every 4 hours. B. Encourage coughing and deep breathing every 4 hours. C. Elevate the head of bed. D. Assess respiratory rate and breath sounds every 4 hours. Answer, D. Assess respiratory rate and breath sounds frequently. Rationale: airway edema after inhalation injury can cause sudden obstruction. Continuous/frequent respiratory assessment ensures early detection and timely airway management. Strategy: in burn patients, airway is the #1 priority. Always choose airway assessment/protection. 19. During an exam, a firm breast mass is palpated in a 35-year-old woman. Which history suggests breast cancer rather than fibrocystic disease? A. Cyclic changes in mass size. B. History of anovulatory cycles. C. History of early menarche. D. Increased vascularity. Answer, C. History of early menarche. Rationale: early menarche increases lifetime estrogen exposure, a known breast cancer risk factor. Fibrocystic disease typically shows cyclic changes with menstrual cycles. Strategy: cancer risk equals non-cyclic risk factors tied to hormones. 20. The client with which type of lung cancer has the best prognosis? A. Squamous cell. B. Oat cell, small cell. C. Small cell adenocarcinoma. D. Adenocarcinoma. Answer, A. Squamous cell. Rationale: squamous cell carcinoma is slower growing, often more localized, and responds better to surgery. Relatively better prognosis. Small cell is the most aggressive. Strategy: remember, small cell equals worst prognosis. Squamous equals best among common types. 21. Warning signs of lung cancer include cough, hemoptysis, dyspnea, and which of the following? A. Generalized weakness. B. Recurrent pleural effusion. C. Dizziness. D. Hypotension. Answer, B. Recurrent pleural effusion. Rationale: pleural effusion is a common complication of lung cancer due to tumor spread/obstruction. Other options are nonspecific. Strategy: pick symptoms directly related to lung/tumor effect. 22. Which intervention is key to increasing survival rates in lung cancer? A. High-dose chemotherapy. B. Early bronchoscopy. C. Smoking cessation. D. Early detection. Answer, D. Early detection. Rationale: survival strongly depends on stage at diagnosis. Earlier stage much better prognosis. Strategy: for cancer survival questions, choose early detection. 23. In terminal lung cancer, nursing care should focus on A. Prepare the client's will. B. Provide pain control. C. Provide nutritional support. D. Provide emotional support. Answer, B. Provide pain control. Rationale: the main goal of palliative care is comfort. Pain control is a priority, followed by emotional support and dignity. Strategy: for terminal illness, always choose comfort-focused care. 24. Which are the 3 main consequences of leukemia? A. Anemia, infection, bleeding tendencies. B. Bone deformities, spherocytosis, infection. C. Polycythemia, decreased clotting time, infection. D. Lymphocytopoiesis, growth delays, hirsutism. Answer, A. Anemia, infection, bleeding tendencies. Rationale: bone marrow suppression leads to RBCs, anemia, WBCs, infection, platelets, bleeding. Strategy: think pancytopenia equals marrow failure. 25. A child has bone and joint pain. Which additional finding suggests leukemia? A. Increased activity level. B. Increased appetite. C. Petechiae. D. Abdominal pain. Answer: C. Petechiae. Rationale: petechiae equals thrombocytopenia, a hallmark of leukemia. Other options don't match the disease pattern. Strategy: in PEDS leukemia, look for bruising, bleeding, pallor. 26. Which type of leukemia carries the best prognosis? A. Basophilic leukemia. B. Acute lymphoblastic leukemia, ALL. C. Acute myelogenous leukemia, AML. D. Eosinophilic leukemia. Answer: B. Acute lymphoblastic leukemia, ALL. Rationale: ALL, especially in children, has the best cure and long-term survival rates. AML generally has worse prognosis. Strategy: ALL equals best outcomes, PEDS. 27. When should antiemetics be administered for chemo/radiation nausea? A. When therapy is complete. B. Immediately after nausea begins. C. With administration of therapy. D. 30 minutes before initiation of therapy. Answer: D. 30 minutes before initiation of therapy. Rationale: antiemetics are most effective when given prophylactically before treatment starts. Strategy: for chemo side effects, think prevent, not treat after onset. 28. The nurse instructs a client to perform a testicular self-examination. Which statement is correct? A. Testicular examination should be done at least every 6 months. B. Gently feel the testicle with one finger to check for growth. C. Examine the testicles while lying down. D. The best time for the examination is after a shower. Answer: D. The best time for the examination is after a shower. Rationale: warm water relaxes the scrotal sac, making abnormalities easier to detect. Strategy: use the test-taking clue, monthly self-exams are correct, not every 6 months. Also, exams should be done standing, not lying. Eliminate incorrect frequency and position options. 29. A 58-year-old man with lung cancer asks how chemotherapy works. The nurse should respond. A. Cancer cells are susceptible to drug toxins. B. Chemotherapy affects all rapidly dividing cells. C. Chemotherapy encourages cancer cells to divide. D. The molecular structure of the DNA is altered. Answer: B. Chemotherapy affects all rapidly dividing cells. Rationale: chemo is nonspecific, targeting rapidly dividing cells, both cancer and normal. Strategy: remember the side effect clue. Hair loss, mucositis, bone marrow suppression. These happen because normal cells also divide quickly. 30. A stomach cancer client has vomiting times 3 days. Labs: K equals 2.9, pH equals 7.46, HCO3 equals 29. This indicates A. Metabolic acidosis. B. Respiratory acidosis. C. Metabolic alkalosis. D. Respiratory alkalosis. Answer: C. Metabolic alkalosis. Rationale: vomiting equals loss of gastric acid increased by carbonate alkalosis. Strategy: use ABG interpretation rules, pH plus HCO3 equals metabolic alkalosis. 31. A 28-year-old female asks when to perform a self-breast exam. The correct answer is A. Day after ovulation. B. Same time every month of the day. C. Every 6 months on the first day of bleeding. D. 7 to 10 days after menses. Answer: D. 7 to 10 days after menses. Rationale: best time, hormones low, breasts not tender/swollen. Strategy: eliminate answers that are illogical, e.g., every 6 months is too infrequent. NCLEX usually tests timing after period. 32. Young men are being taught about testicular exams. Which statement shows correct understanding? A. I perform a self-testicular exam once every 6 months. B. The testicle should feel hard but firm. C. The testicle is examined using all fingers. D. The testicle may have minor lumps due to hormones. Answer: C. The testicle is examined using all fingers. Rationale: use both hands and all fingers, testicles should feel smooth, without lumps. Strategy: apply the safety first clue, no lumps are normal. Reject any answer suggesting lumps/swelling is okay. 33. A patient after bone marrow transplant is at highest risk for A. Liver failure. B. Congestive heart failure. C. HIV. D. Bleeding and infection. Answer: D. Bleeding and infection. Rationale: bone marrow suppression, low WBCs and platelets. Strategy: think priority nursing risk after transplant equals infection and bleeding, not organ damage. 34. Which patient is at highest risk for cervical cancer? A. 21-year-old, first sexual partner at 14, 10 partners. B. 32-year-old, monogamous, declined HPV vaccine. C. 60-year-old, history of syphilis and smoking. D. None of the patients are at risk. Answer: A. 21-year-old who had first sexual partner at 14 and multiple partners. Rationale: early sexual activity plus multiple partners equals highest HPV exposure risk. Strategy: use risk factor recognition. The strongest risk equals early, multiple partners. The HPV vaccine question is a distractor. 35. Regarding breast cancer, which finding is correct? A. The mass is typically painful and red. B. Women with late menarche and early menopause are at risk. C. Nipple retraction is never present. D. Masses are usually felt in the upper outer quadrant or axilla. Answer: D. Masses are usually felt in the upper outer quadrant or axilla. Rationale: most tumors occur in the upper outer quadrant. Breast cancer lumps are usually hard, irregular, painless. Strategy: use the elimination method. Pain/redness suggests infection, not cancer. 36. Radiation protection is important. When not providing direct care, what distance should a nurse maintain? A. 1 foot. B. 2 feet. C. 2.5 feet. D. 3 feet. Answer: D. 3 feet. Rationale: the Alera principle, as low as reasonably achievable, recommends shielding, distance, greater than or equal to 3 feet, and limiting time. Strategy: remember time, distance, shielding, 3 feet is the standard NCLEX answer. 37. What role do economic determinants play in active aging? A. They have no impact on active aging. B. They can limit access to healthcare and resources. C. They are only relevant for younger adults. D. They are the sole determinant of active aging. Answer: B. They can limit access to healthcare and resources. Rationale: economic determinants, like income, pension, financial security, directly affect access to care, healthy food, housing, and resources needed for active aging. Strategy: always link economics access. 38. Which of the following is a behavioral determinant of active aging? A. Physical activity level. B. Dietary habits. C. Smoking status. D. All of the above. Answer: D. All of the above. Rationale: behaviors such as physical activity, diet, smoking, and alcohol use all influence active aging. Strategy: when you see multiple correct lifestyle factors, all of the above is right. 39. What is the impact of healthcare determinants on active aging? A. They have no impact on active aging. B. They can influence access to preventive care and treatment. C. They are only relevant for acute care. D. They are the sole determinant of active aging. Answer: B. They can influence access to preventive care and treatment. Rationale: availability and quality of healthcare affect disease prevention, early detection, and management, all key to active aging. Strategy: link healthcare with prevention plus treatment. 40. Which of the following environmental determinants can influence active aging? A. Access to green spaces. B. Availability of transportation. C. Safety of the neighborhood. D. All of the above. Answer: D. All of the above. Rationale: a safe, supportive environment promotes mobility, independence, and social interaction. Strategy: environment equals all-around impact. 41. What are the main types of gerontology? A. Biological gerontology. B. Social gerontology. C. Psychological gerontology. D. All of the above. Answer: D. All of the above. Rationale: gerontology is multidisciplinary, involving biological, psychological, and social aspects of aging. Strategy: think of gerontology as biopsychosocial. 42. Which type of gerontology focuses on the biological changes that occur with aging? A. Social gerontology. B. Psychological gerontology. C. Biological gerontology. D. Clinical gerontology. Answer: C. Biological gerontology. Rationale: biological gerontology examines physical and cellular changes in aging. Strategy: biological body changes. 43. What is the focus of social gerontology? A. The biological changes that occur with aging. B. The psychological changes that occur with aging. C. The social and cultural aspects of aging. D. The clinical management of age-related diseases. Answer: C. The social and cultural aspects of aging. Rationale: social gerontology studies relationships, social roles, retirement, and cultural factors in aging. Strategy: social society. 44. Which type of gerontology examines the psychological changes and experiences of older adults? A. Biological gerontology. B. Social gerontology. C. Psychological gerontology. D. Geriatric medicine. Answer: C. Psychological gerontology. Rationale: this branch explores mental health, cognition, emotions, and adaptation in older adults. Strategy: psych mind. 45. What is clinical gerontology? A. The study of the biological changes that occur with aging. B. The study of the social aspects of aging. C. The application of gerontological knowledge to clinical practice. D. The study of the psychological changes that occur with aging. Answer: C. The application of gerontological knowledge to clinical practice. Rationale: clinical gerontology applies research to patient care, interventions, and policies. Strategy: clinical practice. 46. Which type of gerontology is concerned with the development of policies and programs to support older adults? A. Biological gerontology. B. Social gerontology. C. Policy gerontology. D. Geriatric social work. Answer: C. Policy gerontology. Rationale: policy gerontology develops strategies, programs, and laws to improve older adults' quality of life. Strategy: policy programs and support. 47. What is a common physical change that occurs in older adults? A. Increased muscle mass. B. Decreased bone density. C. Improved visual acuity. D. Enhanced auditory function. Answer: B. Decreased bone density. Rationale: aging leads to osteoporosis and bone fragility. Strategy: think osteoporosis equals aging bones. 48. Which of the following physical changes is associated with aging? A. Increased flexibility. B. Decreased reaction time. C. Improved balance. D. Increased muscle strength. Answer: B. Decreased reaction time. Rationale: nervous system changes with age lead to slower reflexes and delayed responses. Strategy: reaction time slows with age. 49. What is a common age-related change in the cardiovascular system? A. Increased cardiac output. B. Decreased vascular stiffness. C. Increased blood pressure. D. Decreased risk of cardiovascular disease. Answer, C. Increased blood pressure. Rationale, arterial stiffening and reduced elasticity with age often lead to hypertension. Strategy, always link aging plus stiffer arteries equals BP. If you're enjoying this video so far, like and subscribe. 50. What is a common age-related change in the musculoskeletal system? A. Increased muscle mass. B. Decreased bone density. C. Improved joint mobility. D. Enhanced muscle strength. Answer, B. Decreased bone density. Rationale, with aging, bones lose calcium and minerals, leading to osteoporosis and fracture risk. Strategy, always link aging plus osteoporosis. 51. Which of the following physical changes can affect an older adult's sleep patterns? A. Increased melatonin production. B. Decreased cortisol levels. C. Changes in circadian rhythms. D. Improved sleep quality. Answer, C. Changes in circadian rhythms. Rationale, older adults experience altered circadian rhythms, leading to lighter, fragmented sleep. Strategy, remember, aging early bedtime/early waking. 52. What is a common age-related change in the integumentary system? A. Increased skin elasticity. B. Decreased risk of skin cancer. C. Thinning of the skin. D. Improved wound healing. Answer, C. Thinning of the skin. Rationale. Aging causes reduced collagen and elastin, leading to fragile skin and slower healing. Strategy, skin equals thin plus fragile with age. 53. Which of the following physical changes can affect an older adult's balance and mobility? A. Impaired proprioception. B. Improved muscle strength. C. Increased flexibility. D. None of the above. Answer, A. Impaired proprioception. Rationale, decline in sensory and neuromuscular function impairs coordination and increases fall risk. Strategy, balance relies on proprioception weaker with age. 54. What is a common age-related change in the sensory system? A. Improved visual acuity. B. Decreased hearing loss. C. Presbycusis, age-related hearing loss. D. Enhanced sense of smell. Answer, C. Presbycusis, age-related hearing loss. Rationale, sensory neural hearing loss, especially high-pitched sounds, is common with aging. Strategy, presbycusis equals hearing decline. 55. Which of the following physical changes can affect an older adult's ability to regulate body temperature? A. Increased sweat production. B. Decreased vasodilation. C. Impaired thermoregulation. D. Enhanced vasoconstriction. Answer, C. Impaired thermoregulation. Rationale, older adults have reduced sweat glands and vascular responses, impairing temperature control. Strategy, think aging equals poor heat/cold tolerance. 56. Palliative care can help reduce A. Hospital readmissions. B. Healthcare costs. C. Symptom burden. D. All of the above. Answer, D. All of the above. Rationale, palliative care improves quality of life, decreases unnecessary hospitalizations, and reduces costs. Strategy, always pick all of the above when palliative care benefits are listed. 57. What is an essential aspect of pain management in palliative care? A. Using only pharmacological interventions. B. Assessing pain regularly and adjusting treatment as needed. C. Focusing solely on physical pain. D. Disregarding patient reports of pain. Answer, B. Assessing pain regularly and adjusting treatment as needed. Rationale, pain management is individualized, continuous, and based on patient self-report. Strategy, assessment is the cornerstone of pain care. 58. Palliative care is based on a model of care that is A. Patient-centered. B. Family-centered. C. Disease-focused. D. Both A and B. Answer, D. Both A and B. Rationale, palliative care supports both patients and families holistically, not just the disease. Strategy, patient plus family focus equals palliative model. 59. A patient reports pain in the palliative setting. What should the nurse do first? A. Administer pain medication as ordered. B. Ask the patient to describe the pain. C. Notify the physician immediately. D. Encourage the patient to tolerate the pain. Answer, B. Ask the patient to describe the pain. Rationale, pain is subjective. Assessment must come before intervention. Strategy, in NCLEX, always assess before acting unless it's an emergency. 60. Which pain assessment tool is commonly used to evaluate pain in patients who are unable to verbalize their pain? A. Numeric Rating Scale, NRS. B. Faces Pain Scale, FPS. C. Behavioral Pain Scale, BPS. D. Visual Analog Scale, VAS. Answer, C. Behavioral Pain Scale, BPS. Rationale, the BPS is used for nonverbal or critically ill patients, e.g., ventilated, unconscious. Strategy, verbal equals NRS/FPS, nonverbal equals BPS. 61. A patient in palliative care is experiencing breakthrough pain. What does this mean? A. The patient's pain is well controlled. B. The patient is experiencing a sudden increase in pain. C. The pain occurs only at night. D. The pain resolves without medication. Answer, B. The patient is experiencing a sudden increase in pain. Rationale, breakthrough pain is a temporary flare-up despite baseline pain management. Strategy, think of breakthrough equals sudden flare-up. 62. What is an essential aspect of communication in palliative care? A. Being honest and transparent with patients and families. B. Avoiding discussions about prognosis and treatment options. C. Focusing solely on medical aspects of care. D. Disregarding patient and family concerns. Answer, A. Being honest and transparent with patients and families. Strategy, always prioritize truthfulness, compassion, and clarity in palliative care. Avoiding or hiding information causes mistrust and anxiety. 63. A patient in palliative care has a different cultural background than the nurse. What should the nurse do? A. Assume the patient's cultural values are the same as their own. B. Ask the patient about their cultural values and preferences. C. Ignore cultural differences. D. Refer the patient to a different nurse. Answer, B. Ask the patient about their cultural values and preferences. Strategy, cultural competence requires respect and inquiry. Nurses must individualize care by asking, not assuming. 64. What is the benefit of using open-ended questions in palliative care? A. It allows patients and families to express their concerns and feelings. B. It limits the amount of information shared. C. It is more efficient than closed-ended questions. D. It is only useful for patients with simple needs. Answer, A. It allows patients and families to express their concerns and feelings. Strategy, open-ended questions encourage dialogue, reveal deeper needs, and foster trust. 65. A patient in palliative care is having difficulty understanding their treatment options. What should the nurse do? A. Use simple language and avoid jargon. B. Assume the patient understands and proceed with treatment. C. Refer the patient to a different healthcare provider. D. Provide written information only. Answer, A. Use simple language and avoid jargon. Strategy, health literacy is key. Simplifying communication ensures understanding and shared decision-making. 66. What is an important aspect of communication with patients and families in palliative care? A. Focusing solely on the patient's physical needs. B. Addressing the emotional and spiritual needs of patients and families. C. Avoiding discussions about end-of-life care. D. Disregarding patient and family preferences. Answer, B. Addressing the emotional and spiritual needs of patients and families. Strategy, holistic care addresses physical, emotional, and spiritual dimensions. 67. A family member of a patient in palliative care asks the nurse about the patient's prognosis. What should the nurse do? A. Provide a direct and honest answer. B. Avoid discussing the prognosis. C. Refer the family member to the physician. D. Provide false hope. Answer: A. Provide a direct and honest answer. Strategy: honesty builds trust. If unsure, the nurse should be truthful and collaborate with the healthcare team, never give false hope. 68. What is a fundamental principle of end-of-life care in palliative care? A. Patient autonomy and self-determination. B. Physician-assisted suicide. C. Withholding all treatment. D. Mandatory hospitalization. Answer: A. Patient autonomy and self-determination. Strategy: respecting patient choices is central to palliative and end-of-life care ethics. 69. A patient in palliative care requests to stop receiving life-sustaining treatment. What is the nurse's role? A. Convince the patient to continue treatment. B. Support the patient's autonomy and discuss options with the healthcare team. C. Refuse to participate in the patient's decision. D. Ignore the patient's request. Answer: B. Support the patient's autonomy and discuss options with the healthcare team. Strategy: nurses advocate for the patient's wishes while ensuring the team discusses safe, ethical care plans. 70. What is an important ethical consideration in end-of-life care? A. Respecting the patient's right to refuse treatment. B. Prioritizing curative treatments over palliative care. C. Disregarding patient and family preferences. D. Focusing solely on medical aspects of care. Answer: A. Respecting the patient's right to refuse treatment. Strategy: autonomy and dignity guide ethical practice. Respecting refusal of treatment is a legal and ethical obligation. 71. A patient's family member requests that the patient not be told about their terminal prognosis. What should the nurse do? A. Honor the family member's request. B. Discuss the issue with the healthcare team and consider the patient's autonomy. C. Tell the patient the prognosis despite the family member's request. D. Ignore the family member's request without discussion. Answer: B. Discuss the issue with the healthcare team and consider the patient's autonomy. Strategy: ethical practice requires balancing honesty with sensitivity. Patient autonomy must be respected, but the healthcare team should discuss how best to approach disclosure. 72. What is a human rights issue in end-of-life care? A. Access to palliative care services. B. Respect for patient autonomy and dignity. C. Protection from unnecessary suffering. D. All of the above. Answer: D. All of the above. Strategy: human rights in palliative care involve access, dignity, autonomy, and freedom from suffering. 73. What is an important aspect of respecting patient autonomy in end-of-life care? A. Involving patients in decision-making about their care. B. Disregarding patient preferences. C. Prioritizing family wishes over patient autonomy. D. Focusing solely on medical aspects of care. Answer: A. Involving patients in decision-making about their care. Strategy: autonomy means patients must actively participate in their care decisions. 74. A patient in palliative care requests assisted dying. What should the nurse do? A. Support the patient's request without discussion. B. Discuss the issue with the healthcare team and consider the patient's autonomy and legal implications. C. Refuse to participate in the patient's request. D. Ignore the patient's request without discussion. Answer: B. Discuss the issue with the healthcare team and consider the patient's autonomy and legal implications. Strategy: the nurse must not act alone. Assisted dying is legally restricted in most places. The nurse's role is to support, listen, and consult with the healthcare team. 75. What is the principle of non-maleficence in healthcare ethics? A. Doing good and promoting the patient's well-being. B. Avoiding harm to the patient. C. Respecting the patient's autonomy. D. Distributing resources fairly. Answer: B. Avoiding harm to the patient. Strategy: non-maleficence means do no harm, guiding safe, ethical nursing practice. 76. An abnormal mass of tissue that forms when cells grow and divide more than they should or do not die when they should is referred to as A. Neoplasms. B. Benign. C. Malignant. D. Tumor. Answer: A. Neoplasms. Strategy: the general term for abnormal cell growth is neoplasm. Tumors can be benign or malignant, but the umbrella term is neoplasm. 77. Kidney cancer refers to all except one. A. Adenocarcinoma of the kidney. B. Renal cell carcinoma. C. Cysts. D. Wilms tumor. Answer: C. Cysts. Strategy: cysts are fluid-filled sacs, not cancers. The other three are types of kidney cancer. 78. The type of kidney cancer in children is called A. Adenocarcinoma of the kidney. B. Renal cell carcinoma. C. Cysts. D. Wilms tumor. Answer: D. Wilms tumor. Strategy: Wilms tumor is the most common pediatric kidney cancer. 79. Kidney cancer accounts for about of cancers in adults, affecting about twice as many men as women. A. 1 to 2%. B. 2 to 3%. C. 3 to 4%. D. 4 to 5%. Answer: B. 2 to 3%. Strategy: renal cancers are relatively uncommon, but more common in men than women. 80. Risk factors for developing kidney cancer include all except one. A. People who smoke. B. Exposure to toxic chemicals, asbestos, cadmium, leather tanning, petroleum products. C. People who are undergoing dialysis and develop cystic kidney disease. D. People who lose weight. Answer: D. People who lose weight. Strategy: weight loss is a symptom, not a risk factor. Smoking, toxins, and dialysis are true risks. 81. The most common first symptom of kidney cancer is A. Blood in the urine. B. Pain in the area between the ribs and hip, the flank. C. Fever and weight loss. D. An enlargement or lump in the abdomen. Answer: A. Blood in the urine. Strategy: hematuria, blood in urine, is the most frequent initial sign of kidney cancer. 82. Nonspecific symptoms of kidney cancer include all except one. A. Fatigue. B. Weight gain. C. Early satiety, feeling of fullness after a meal. D. Polycythemia. Answer: B. Weight gain. Strategy: kidney cancer usually causes weight loss, not gain. Fatigue, early satiety, and polycythemia are associated. 83. Diagnosis of kidney cancer include all except one. A. Computed tomography, CT. B. Magnetic resonance imaging, MRI. C. Lab test. D. Ultrasonography. Answer: C. Lab test. Rationale: blood/urine tests may show abnormalities but do not confirm diagnosis. Imaging, CT, MRI, ultrasound, are diagnostic. Strategy: look for the accept option, lab tests help but are not diagnostic. 84. The major treatment for kidney cancer include all except one. A. Surgery. B. Immunotherapy. C. Medications. D. Radiation. Answer: D. Radiation. Rationale: kidney cancer is usually resistant to radiation. Surgery is primary, immunotherapy and targeted drugs are used. Strategy: eliminate the least effective treatment for kidney tumors. 85. Procedure done by radiologists to burn/freeze the mass on the kidney is called A. Ablation. B. Active surveillance. C. Radiation. D. Cryosurgery. Answer: A. Ablation, includes radiofrequency ablation or cryoablation. Rationale: ablation is a minimally invasive radiology technique for small renal tumors. Strategy: recall, ablation equals destroy tissue by heat/cold. 86. The medications that alter molecular pathways that affect tumor cells are called: A. Immunotherapy. B. Targeted therapies. C. Chemotherapy. D. Selective therapies. Answer: B. Targeted therapies. Rationale: these drugs, e.g., tyrosine kinase inhibitors, specifically block cancer growth pathways. Strategy: targeted equals directly interferes with tumor signaling. 87. The cancer that can occur in the cell lining the central collecting area of the kidney, the renal pelvis, is called: A. Urothelial carcinoma of the renal pelvis. B. Endothelial carcinoma of the renal pelvis. C. Squamous carcinoma of the renal pelvis. D. Epithelial carcinoma of the renal pelvis. Answer: A. Urothelial carcinoma of the renal pelvis. Rationale: the renal pelvis is lined with urothelium, so cancer here is urothelial carcinoma. Strategy: match the tissue lining, urothelial carcinoma. 88. The less common cancers of the renal system include: A. Cancers of the renal pelvis and ureter. B. Cancers of the kidney. C. Cancers of the bladder. D. Cancers of the urethra. Answer: A. Cancers of the renal pelvis and ureter. Rationale: these are rare compared to kidney and bladder cancers. Strategy: always choose renal pelvis/ureter when asked about less common cancers. 89. The greatest single risk factor and one of the causes in at least half of all new cases of urinary bladder cancer is: A. Alcohol. B. Obesity. C. Smoking. D. Diabetes. Answer: C. Smoking. Rationale: cigarette smoking causes toxic chemical accumulation in urine, making it the top risk factor. Strategy: remember, smoking equals bladder cancer, 50% plus of cases. 90. Symptoms of bladder cancer include all except one: A. Blood in the urine. B. Pain and burning during urination. C. An urgent, frequent need to urinate. D. A low blood sugar may cause fatigue, paleness, or both. Answer: D. A low blood sugar may cause fatigue, paleness, or both. Rationale: hypoglycemia is unrelated to bladder cancer. The first three are classic urinary symptoms. Strategy: spot the option not related to the urinary system. 91. Diagnosis of bladder cancer include all except one: A. Sugar in urine. B. Cytology, urine examined under microscope. C. Cystoscopy, visualization of bladder interior. D. Biopsy, examination of bladder tissue. Answer: A. Sugar in urine. Rationale: glucose in urine relates to diabetes, not bladder cancer. The others are standard diagnostic methods. Strategy: always eliminate non-cancer specific tests. 92. The diagnosis of bladder cancer is often first suspected when this is found in the urine: A. Sugar. B. Blood. C. Bile. D. Protein. Answer: B. Blood. Rationale: hematuria, blood in urine, is the earliest and most common sign of bladder cancer. Strategy: always associate blood in urine bladder/kidney cancer suspicion. 93. Special microscopic evaluation of urine to detect cancer cells in the bladder is: A. Cystoscopy. B. Biopsy. C. Histology. D. Cytology. Answer: D. Cytology. Rationale: urinary cytology looks for cancer cells shed into urine. Strategy: cytology equals cells identifies malignant cells. 94. Sometimes bladder cancer is detected when an imaging study such as .. is done for another reason: A. Ultrasonography or MRI. B. Computed tomography, CT. C. Magnetic resonance imaging, MRI, or CT scan. D. Ultrasonography or CT. Answer: C. Magnetic resonance imaging, MRI, or CT scan. Rationale: bladder cancers are often incidental findings on CT/MRI. Strategy: CT and MRI are key cross-sectional studies for incidental cancers. 95. Most bladder cancers are diagnosed by A. Cytology and biopsy. B. Cystoscopy and biopsy. C. Histology and cytology. D. Histology and cystoscopy. Answer: B. Cystoscopy and biopsy. Rationale: direct visualization, cystoscopy, plus tissue confirmation, biopsy, is the gold standard. Strategy: always look for biopsy when diagnosis confirmation is asked. Great job! You just completed 95 NCLEX style questions. Review rationales carefully, they teach you why an answer is right and why the others are wrong. Practice using these critical thinking strategies so that, on exam day, you'll confidently pick the best answer every time.